Treatment of pyelonephritis without retention or sepsis. The treatments usually employed are hygiene, hexamethylenamine, pelvic lavage, and vaccines. Hygiene. The hygiene is that of chronic non-bacterial nephritis. If the kidney function is definitely impaired, the patient's weight should be reduced by a diet free from alcohol and with low proportion of nitrogen. His health may be expected to improve if he keeps in the open air, avoids worry and hard physical and mental exertion. Hexamethylenamine. Hexamethylenamine is all but synonymous with urinary antisepsis. The other drugs employed for this purpose have never been proven to have any value. Hexamethylenamine is a combination of ammonia and formaldehyde. Its only effect is an antiseptic one, due to the liberation of formaldehyde from it in acid solution. Hence, it is only efficient in the stomach and in the urine. The liberation of formaldehyde in the stomach is merely an inconvenience on account of its irritating properties. This inconvenience may be overcome by administering the drug in saline or keratin-coated capsules. The observations of Burnham, George Smith, Hinman, and others have shown that in order to have any antiseptic effect, the formalin liberated in the urine must be in a concentration of at least 1 to 30,000. The drug must be administered in doses of at least 1 gram 3 times a day to obtain this concentration. Footnote: there are very rare exceptions to this rule. Persons who are irritated by small doses of hexamethylenamine sometimes obtain unquestioned antiseptic effect from still smaller doses. I have known a patient who could not keep his urine clean in any other way to keep it free from pus for years by doses of hexamethylenamine of less than 1 gram a day. Inasmuch as the drug breaks up rather slowly, it is questionable whether it is often antiseptic in the kidney pelvis at this dose. Hinman. It is likely to have no value in acute nephritis, for the excretion of solids is notably reduced under these circumstances, so that the excretion of hexamethylenamine must be very small. The theoretically ideal dose is 2 grams 4 times a day. The effect of this may be distinctly increased by the administration of acid phosphate of sodium, 2 to 3 grams a day, in order to increase the acidity of the urine. The maximum excretion of the drug occurs within a few hours of its administration. It may seem wise to control the administration of hexamethylenamine by Burnham's test for formalin in the urine. Thereby, we may estimate the proper amount in order to get a given result. But practically speaking, the susceptibility of different individuals to the toxic action of the drug varies greatly. The liberation of too much formalin in the urine produces frequent and painful urination and even hematuria. Warren Coleman has collected a number of cases of hematuria following the administration of very small doses. A single dose of less than 1 gram has several times caused this result, but so rare is this phenomenon that it is usually safe to begin with a dose of 1 gram 3 times a day and increase until the limit of toleration is found. If the urine is not acid, the administration of the drug is accompanied by 1 gram 3 times a day of acid sodium phosphate. When the limit of toleration is found, the drug is administered at a point just below this. If no benefit is obtained in the course of a week or 10 days, the drug may as well be abandoned. Pelvic lavage. The pelvis of the kidney may be washed out through a ureter catheter once or twice a week. The most valuable solution for this purpose is silver nitrate in strength of from 0.5 to 1%. Not more than 2 cc should be injected, and this should be permitted to run out through the ureter catheter. Garrity has advised that silver be used in as high as 5% strength. This is very painful, but he states that it cures certain cases that are not cured by the milder solutions. Pelvic lavage should not be employed in acute cases, in cases with retention of urine in the kidney pelvis, in cases with definite impairment of the function of the kidney, as estimated by the phenylsulfoneptylene output. Under favorable circumstances, it is even claimed, e.g. by Garrity, that favorable cases may be actually cured, even of a Bacillus coli infection, by this lavage. Their active symptoms may certainly be relieved. Vaccines. Vaccines, whether autogenous or stock, are of no value in this class of cases. Summary. As an actual fact, the great majority of the mild cases of renal infection without sepsis or grave retention do not even come for treatment. They consider themselves practically well, and the most mildly infected suffer so little and are offered so little prospect of help by any treatment that one cannot blame them for shirking. I have relieved, but never cured, such cases by the method of pelvic lavage. I have also known them to be relieved by high doses of hexamethylenamine. I have seen 2 cures result from treatment at a diuretic spring where the patient for several weeks drank very large quantities of water.